Good afternoon everybody, I am Bhumandeep Kour from Lovely Professional University. I am a PhD scholar. Today my topic of video abstract is Identification of Potential Candidate Biomarker in Cancer Prostate by combining machine learning and in silico approaches. To get introduced with the topic, so as we already know that the obesity and type 2 diabetes are well known established conditions to be associated with the prostate cancer. Multiple factors which helps in these associations are the hyperinsulinemia, IGF-1, hyperglycemia, hyperlipidemia, adipokines, cytokines, and gut microbiome. Also, prostate cancer are found associated with another disease condition which is disseminated intravesicular coagulation, in which vitamin K plays a very crucial role. Also, PSA, which is a prostate-specific antigen, as a protease, which is a member of callicarin, also, which is further also a protease, and PSA is found to play a role in coagulations also. Here we can add that on vitamin K status might be a missing link to a prostate health, and its understanding could lead to a better patient management. So, as we also know that the PSA is the most widely used biomarker for prostate cancer diagnosis, but it's associated with several variables actually, which leads to false positive results many of the times, and unnecessary biopsies are done in older people. So, considering these points, we have three objectives, which are as literature survey or text mining to select some clinical parameters for prostate cancer and associated comorbidities like diabetes, obesity, and vitamin K deficiency. Secondly, development of a risk scaling model by binary conversion of deviated values from the threshold values to apply a machine learning algorithms. And then at last, identification of potential biomarker using in silico approach by correlating with few prostate cancer patient samples, RNA-seq and exome data. If we here is my methodology, where first we have taken, after doing the literature survey, we have taken some parameters of our interest, like clinical parameters specifically. After that, we have converted their values, the deviation from the normal range. We have converted all the data into the binary values to apply the better machine learning algorithm on it. And then at last we have to compare all this. The binary conversion will be from lower risk to higher risk. We have taken like -1, -0.50, 0.5, and then last one, which could be considered as the highest risk value. Then we have used the in silico approach, which will be applied to check how the deviation of the parameters could show impact on our the correlated data that is we're going to correlate, that is RNA-seq or exome data, genes, that is our own data, and which could show that how it is showing impact on each other, and vice versa, more precisely to understand how these impacts and effects could lead to the cancer progression if they are interfering with each other. So more specifically, we are focused on prostate cancer. First of all, we have taken the parameters for prostate cancer. First of all, we have taken the parameters for prostate cancer, that are PSA level, Gleason grading, minor allele frequency, DRE values. All these values are seen corresponding to their normal ranges, and we try to make a risk stratification from the lowest risk to higher risk. Based on that, we have given the binary coding from starting from the lowest risk, that is minus 1, from going minus 0.5 to 0, then 0.5 to at last the highest risk, that is considered as we can suppose to consider that as giving the one value. So we have given these in correlation with the deviation as from lower risk to higher risk. Similarly, for the diabetes, we have taken minor allele frequency, glycolated hemoglobin, then fasting blood glucose, then body mass index, and then for obesity, MAP value, BMI, LDL, HDL or LDL values. Then for vitamin K, we have minor allele frequency, PT test, clotting time, VK antagonist test. Then, so here we have all for the data for the risk stratification, how we can develop the model based on the lower to higher risk. Then for correlation, we have sorted out all the genes, what we have gotten from the NCPI source also, that was the clean bar map data and our exome data, RNA-seq data. We have collected all the genes, and then we have tried to check how they are common, if any commonality is there. Then we have from diabetes, prostate cancer, obesity, we have one commonality, diabetes, vitamin K and obesity 1, diabetes, prostate cancer 4, prostate cancer, obesity 5, at last diabetes and obesity, which has shown the commonality, most commonality, that is 71. So we are going to correlate all this data and check how both are showing impact on each other. For this impact analysis, we will use Cytoscape, we will use cBioportal, RNA Central. All these in silico approaches will be applied on it to check how they are interacting with each other to get down a specific regulatory biomarker, so that it could be a more potential biomarker could be which could be more helpful in future diagnosis. So in conclusion, we have this could be helpful in developing the risk stratification and identifying risk markers for vice versa associations. Finally, this would help in developing a machine learning model which will help the clinician in better diagnosis and prognosis. Also, I would like to add the identification of a potential biomarker also. Then for in the future, accordingly we have to design a machine algorithm. We will use the cBioportal to check how the expression differences is there, so that we can see how they are if the deviation in some part is there, how their expression might be changing. Then RNA Center we will also associate with the RNA part also. Then after, if we get to narrow down, if we got to narrow down a particular biomarker, we will check with the help of cell lines also that how if our experimental work is ensuring all the results or not. So we will check it experimentally also. That's all. Thank you. Suggestions.